Okay, we're all sorted. So good morning, I'm Jonna Mazet. Thank you very much to the Pan American Health Organization for hosting us this morning and the Academies for inviting me. I'm excited to talk to you today about how we're trying to gather big data, use big data, and then the challenges of extracting just the pieces that we need for pandemic prevention. So hopefully I'll whet your appetite for discussion later, and we just have a bit of time to get going, so we'll look forward to questions as we move forward. So a few years ago, going on 7 years ago, the U.S. Agency for International Development put out this challenge, primarily here in the U.S., but globally put out this challenge to try and get people to think about and come forward to stop at the source the first stages of emergence of zoonotic diseases. And that was a pretty crazy challenge, right? So first of all, could you please stop everything that you don't know might happen before it happens? And it was one of those things that I think took some wildly optimistic and unrealistic people to come together to try to address, because also if you're successful, no one knows, right? If you're successful at stopping things before they start, you tend to stop getting funding as well, right? Because no one's interested in it anymore. What a great problem that would be to have no more zoonotic disease emergence, though. So it's still a good challenge to try and respond to. So the PREDICT project was born, again, just about going on 7 years ago. And so I was fortunate enough to be brought together with some amazing people, including Peter Daszak here on your panel. He's waking up. Hello. And as well as some of your esteemed leaders here on the forum. So both Lonnie and Jim have been great contributors and have provided us wonderful guidance for this project. In addition, we brought together the country governments in a true One Health capacity. So we brought together the Ministries of Health, Ministries of Agriculture, and Ministries of Environment to try and think about zoonotic disease emergence, because often we're in this responsive mode, chasing the last spillover event that resulted in an epidemic, and hopefully not, but potentially a pandemic. And so instead we wanted to move that bar and start talking to each other early. And so we're lucky enough to have the impetus, and we thought it was going to be a really big challenge to get those folks to come together. Of course, silos are difficult to break down, but I will say the topic of emerging pandemic threats is a good one for this kind of discussion, because everyone's concerned about it, and mostly nobody has a system in place to bring folks together. Even in this country, we don't have a system in place to really come together to talk about zoonoses and spillover in a really effective way. So in the 35 countries where we've worked so far with the PREDICT project, that we were there helping them with a problem that they recognized, and they didn't have a system or funding in place to be able to look for things that they didn't know were there, gave us a forum like today. Am I screaming at you?
No, it's not. You are not showing. Sorry.
Oh.
Something happens.
Oh, there's no slides. Yes. They're here. I'm looking at them, thinking they're pretty. Oh.
Okay, we got it.
Thanks. Want to see the other ones? No, it's fine. Yeah. That's the important one, all the different partners. And that is the critical piece, is bringing together the important players. So I'll talk about some of these folks today, but when we really are thinking about the data piece, it's all the people gathering the data, then processing the data, and then getting the data back out. And the getting the data back out piece is been really facilitated by the HealthMap folks. So I'd like to give them a shout out for this particular forum today. So how did we start? First, we started by looking at the big problem. So we know that zoonotic diseases are, usually from viruses in wildlife. So in the 20-year period between 1990 and 2010, 91% of all zoonotic disease spillover events were from wildlife. So we know that's where we should be looking. That's where we've underlooked, if you will. And so we have these pathogens, or before they're even pathogens, potential pathogens, circulating in wildlife species, and they have the opportunity to spill over and cause disease in domestic animals and humans. So the blue curve, the classic epidemic curve in domestic animals, and then they can amplify in those animals and spill over to people, or we could have that spillover directly from the wildlife into the red curve. And of course, I think many of us here today, our challenge is to try and lower those curves and reduce, if not make them disappear altogether. And so how do you do that? Well, there are different control points that we can get involved in, but really what I think the big concern is getting involved too late. So if we jump in after the fact, we make vaccine or we deliver vaccine after we're sort of on the far side of those epidemic curves, we're really putting a Band-Aid, right? We're throwing almost good money after bad, because our vaccine is likely not going to be a vaccine that's useful for the next most important thing that's going to spill over. History has shown that to us time and time again. So I think USAID was very thoughtful and forward-thinking to say, look, we are providing a lot of vaccine to the world. We want to do it better. We want to be ready in advance rather than responding. Certainly, there's tons of excellent work in influenza going on, trying to get in front of that curve. But it's sort of following the same path. And so I think Dennis Carroll, who's here today, was really a visionary to jump out and say, let's think about this differently. Let's make this big, go to scale with an experiment and see if we can get all the way to the front, back to the green area, find out what's out there, and see if we can come up with ways to mitigate the spillover, and heaven forbid, once the spillover happens, how to mitigate the spread. So the PREDICT team put together a consortium and bid for this project. Again, kind of crazily. We didn't necessarily know what we were getting ourselves into, but it's an excellent challenge. And so the first place big data came in was to really start to help us target our surveillance. And so we had to do a really deep dive, looking at all of the data out there. And Peter leads our modeling and analytics team that's done a ton of work to put together the best data so that we could make the best surveillance plan. So we targeted species, locations, and interfaces, or those ways that people and animals were coming together to allow that spillover of a pathogen to happen. We also needed to come together and figure out a pathogen diagnostic and discovery team, discovery platform, because, as most of you know, there aren't great diagnostics for things that we don't know are out there. So how do you run a diagnostic test for a new pathogen, right? And so yes, we have metagenomics in some places in the world. It's very expensive. And oh, by the way, if you don't know what you're looking for, you still just have a lot of noise. You don't know what's in that sample. So you still need to have the data to back you up, to make the libraries to figure out what's in that sample. So we needed to figure out how to put together a diagnostic platform in the to apply in the least developed countries in the world, because that's where the modeling team was saying was the most likely for this spillover event to happen. And we wanted to pick up both known pathogens and novel pathogens. And so that was our big challenge. Then, how do we handle that information, and how do we get that information back into the hands of the people that needed it? So we needed to have sort of an iterative approach, get the data, process the data, get it back to the modeling and analytics team to improve the models so that we can continue to target where to work. Many of the models were showing us, thank goodness, what we expected. So I don't think that we should forget about our brains in this scenario, right? So we can think about what kind of viruses are likely to infect people. What kind of viruses are likely to spill over? Well, they're the ones that we most often have seen in the past. So we want to learn from the past. What kind of hosts? Well, common sense will tell us hosts that are most closely related to us are going to share pathogens with us most, and hosts that we live most commonly interact with are going to be the most likely to be able to expose us, right? So we started to think about, okay, domestic animals, right, the ones we eat especially, well, we've known and have documented some pathogen spillovers there. Other ones that adapt to live with us well, like rodents, even bats, although people surprisingly don't notice that bats are in their belfry, if you will. That's me, actually, in their attics. But then non-human primates as well, a big source. But we did the hard work in many different ways. We did ecological modeling. This is an example of the epidemiologic modeling, where we also looked at all the interfaces and said, if you're a virus, if all the red dots are viruses, if you're a virus and you share different modes of transmission and different interfaces with other viruses, then that's an interface we want to target for our surveillance. So we could put every zoonotic virus that we've seen in the last 20 years onto this network analysis and say, how are they being transmitted? In what different venues and interfaces are they being transmitted? And you'll see the clustering, the vector-bornes cluster together, right? And then there's this kind of mess, frankly, of the rest that are sharing a lot of interfaces. Well, that tells us they're risky. The bigger the virus swells, the more interfaces it's been transmitted in the last 20 years. And the more worrisome that interface is, and then we need to jump in and look at it. And then we also had to get on the ground. So all of our teams in the countries, we're in 31 countries today, and all of the teams in the countries are citizens and working in those countries, from those countries, and they're telling us what's happening on the ground. So the things that show up in the literature that we can mine with our data mining is not everything, right? We don't want to be waiting for things to show up later in the literature and say this was a risky interface because we documented. We want to get to the predictive point. So the building up of bat guano farming as an industry, and especially Southeast Asia, was something that our team said, hey, look, we know now that there's stuff in bat feces. We're worried. Should we be worried about this new cottage industry that's really growing? And guess what? If you build beautiful condos for bats, they will move into them. That's what these are. So if you hang palm fronds up next to the forest and make it really attractive, the bats will come out, they will defecate for you, and you can pick it up, and what are you going to do with it? Put it on your crops and eat it, right? Okay, so if we're worried about bats and coronaviruses and things like that, we should be thinking about these interfaces, even if they haven't shown up in the literature yet as risky. I'm also worried not just about the people who are going to eat the crops, that's a broader scale worry, but what about the guano farmers? You can see them here, working with the fresh guano, okay? Now, also I want to know if they put it out in the sunshine and UV irradiation kills the virus and then it becomes more safe and a great source of fertilizer, we want to know that as well. We don't want to come in, right, from another country and say, everything you're doing is risky, stop that, right? People need livelihoods. People need to move forward with their capacity and build up a good life. And so we need to come in with the right kind of data, the right kind of science. And that's what we attempted. So we looked at the high-risk interfaces in every country, both real-time and from the literature. And then the big data also came into play for the large-scale ecological drivers. So we can't forget about what's causing people to change? What's making people build those bat condos? What do they need, right? So poverty is certainly a big driver, but land use change and agricultural industry change drives our behavior, and then our needs drive that behavior and change there. Human population density and wildlife biodiversity have been shown for the last 10, 15 years over and over and over again to be important drivers here, so we can't leave those out of our models either. So I'm going to tell you now about what we were able to achieve in the first 5 years of the project, and where we're going, and then maybe we can have a discussion about that. So what were we able to do? In the first 20 countries, we worked in 20 countries in the first 5 years, we were able to train the folks in the countries working on our teams and in the ministries and universities in those countries to safely collect samples where we were looking for the most deadly viruses in the world. So this is big biosafety concern as far as asking people to go out. Now maybe what they're doing isn't that different than what they did in their research or ministry jobs before, but if we're saying we're looking for something dangerous, we sure better do that safely, right? So we're training in PPE and safe sample handling and safe animal handling. We don't kill any animals in the PREDICT project. And so this is a monkey being trapped by one of our guys. In the first 5 years, we were able to sample 56,000 animals. So get up and running in the countries, get folks trained, and then get them out and safely sampling animals. We did develop and operationalize a diagnostic platform. That was a huge challenge for us because it wasn't something we initially thought was going to be on our plate in the PREDICT project. We thought we would have partners to do that. And that was a big challenge, but I think it was the right decision for our team to do that because, again, we didn't know what we were looking for, and we knew we couldn't operationalize high-throughput sequencing or deep sequencing in all the countries where we were working. So we went to a consensus-based PCR approach that I don't have time to talk to you about today, but would be happy to. But suffice it to say, we looked for about 20 different viral families, all of the ones that had caused epidemics and pandemics in the past. And in those first 5 years, in the countries where we were working, we were able to get up and running and run 400,000 diagnostic tests. Now, that resulted in us finding about 1,000 viruses in the first 5 years. Some known, about 182 known viruses, and the remaining novel. Okay, so we have known bad actors that we're picking up with our platform. That's good news. The platform's working. We're finding and able to change the maps, change and say this pathogen is actually in a different place than we thought it was before, or it's in a different host than we thought of before, so that gives us a lot of information. But we're also able to find novel ones, and ones, again, from those viral families that we think might spill over. So we could prove, we had the proof of principle that this could be done, and it could be done rapidly in some of the least developed countries in the world. And what did we find? Well, we found those viruses that we were looking for. That's, if you seek, you will find. But we're up to about 100 coronaviruses now. So this is the five-year table, but we're another year and a half in, and we found over 100 novel coronaviruses. So if there were just a few coronaviruses discovered before, and some of those were really bad actors, right? We have SARS and MERS and all the things that are making my head stuffy today. But there's now 100 new ones. And what do we do with those? How do we figure out what to do? And how is that helpful? So I can tell you one example of how that's helpful is that when we were looking, we were gathering all of this data and getting the information. So when MERS was found, our teams were able to jump in immediately and say, okay, in the 3 continents where we're working, these are the closestly related viruses to the ones you found making people sick in the Middle East, because we weren't working in the Middle East. Maybe you should look in these hosts and these kinds of conditions. And we were finding closely related viruses in places like Mexico and Thailand, and so able to help those teams in real time. We're also able to, for the first time, start to come up with a scientific basis to seek things that we haven't sought before in the viral world. So how do you do the math? How do you do a significant sample strategy strategy, well, we could get viral discovery curves. By intensively sampling specific species in specific locations, we could start to see where you saturate that curve. How long does it take you? How many samples do you need to find every single virus in that species? That helps us down the road to determine whether this is a realistic endeavor to take to scale beyond the 20 countries we were working in the first place. So this is the hotspots model. Again, Peter's team refined from the Jones hotspots, and we're able to take that to the next level and say, okay, yes, human population density and wildlife biodiversity, important, but also what's really critically important are changing population density, are changing agricultural practices and land use and other things. And so if you'll bear with me, just quickly, lots of red here, less red here, right? And that's our goal, is to continue to target and refine where we need to look for these things to be efficient, right? And I'm sure Peter can answer questions about that. In addition, the data were helping us to be able to supply information and participate with our colleagues in the country. So in the first 5 years of PREDICTS, we did 23 outbreaks. So we assisted the governments in the countries. Often they were being assisted by CDC and WHO, but we were assisting them with all the background knowledge that we could find and the models to help them identify what might be going on, especially for mystery diseases, and then when necessary, help them with the diagnostic platform so that they could actually identify disease. So some of the most important things to think about here is our teams assisted in DRC, the detection of Ebola virus, and the implementation by the Prime Minister's office within just a few days of reduction in movement of people in DRC while the West African outbreak was ongoing. We're able to say it wasn't the same strain, and that outbreak ended in very small amount of time with less than 100 people dead. In contrast to, unfortunately, where we weren't working, where folks weren't looking for Ebola and didn't expect it, and we see the horrible tragedy that happened there. Okay, so sorry for that. I thought I fixed that title there, but here's how it works on our side. So we get out, we sample, get those samples analyzed in the lab, get that data analyzed, okay, and when we find all the different strains of virus, we have to decide, are we talking about a new virus or an existing virus with a new strain? That's a big data problem, and we could talk about that more maybe with the panel. And then get in there and get that information to the local government. So we take every single virus that we find, goes to the Ministry of Health, Ministry of Ag, and Ministry of Environment for review with our interpretation and their consultation and interpretation, and then it goes out into the public sector through HealthMap. And we have not had a big challenge in this project of getting the ministries to release that data. We thought it would be our biggest challenge, was getting the ministries of the countries we were working to release the data. I think because we worried about it so much and we talked to them so much, and probably, oh, by the way, Dennis, probably close your ears, told them we couldn't work there and give them any money to do this work unless they were willing to release it later, which was true, right? We need to get the information to the public. We can put our investment somewhere else. There are a lot of important, needy places to get this work done. So we had that coordinated interpretation and then pushed it out through HealthMap. And here's just a screenshot of our HealthMap site. You can go into predict.global on the web and you can click on our surveillance and it'll take you right to this site, or you can find it within HealthMap. It's a little harder to navigate to find it within there. But you can click on the hotspots map that you saw before. Then you can click on our layer that shows every sample that we've collected throughout the world, and then the preliminary test results for those samples that are being made public. It'll tell you this level of information. We found a new adenovirus, what we've named it, and in what host, and and when we got it, and that there's no evidence at this time that the virus poses a threat to human health. If it's closely related to something that is a human pathogen, it would say that there. And then you can click to access the whole sequence in GenBank if we've gotten the whole sequence, or the partial sequence if it's from cloning and sequencing of our PCR product. Now, not everything's in GenBank yet. The governments have released the data so that all the data is available, at least to this level. Then sometimes they want to get their publications and things before they go into GenBank, but nothing stays with us more than 3 years. Everything the complete sequence gets out into GenBank within 3 years. And we haven't had any issues when there have been any public health emergencies with accelerating that. So that's been going quite well. So now what? We have all these viruses. We need to figure out which ones are important. And I was a little frustrated that the big data in the world didn't help us to really rank the viruses for the ones most important. In fact, that near neighbor thing, the most closely related to this virus, doesn't work. We know that from virology now, that things that are most closely related doesn't mean that they're likely to be infectious to humans or transmissible human to human. So our team is coming together, our modeling team as well as our epi team and our virology team, to really put together for the first time a ranking system. Will we be right? No. We'll be wrong, but at least we'll get the conversation going so that we're not just taking the virological data and trying to rank viruses, but we're taking the epidemiologic data. So how are these interfaces working? What is the likelihood that people will come in contact with the host? And the ecological data. What is happening in the world that might drive this pathogen or these hosts of this pathogen to change, move, be disturbed, come into contact with people? So we're very excited about that moving forward. In addition, we've started to look in the people. Okay, so look in the livestock and the people. The first 5 years we looked mostly in the wildlife. We know that's where we expect these things to be, but we want to document the sharing now because we want to get to the place to say these are not only potential pathogens, but they also are infectious to people. We're finding them in sick people around those interfaces. And those people are practicing these risky behaviors so that we can start to target and find palatable interventions ahead of the big epidemic or pandemic. So the behavior piece is really critical. And so there's a funny quote Dennis likes to use. Donald Rumsfeld talks about what we know and what we don't know and what we know we don't know. But anyway, what do we know? We know that we have a huge increasing population, and that's giving us expanding settlements into wild areas, increasing domestic animal production in those wild areas where the domestic animals might mix with the wildlife, crop production and people using and needing fertilizers like I talked about before, and increasing natural resource extraction, taking people deeper and deeper into areas where they're going to meet hosts that humans haven't necessarily interacted with on a large scale before. So increasing human-animal contact and spillover, and the risk for disease. And so I'm just giving you a little teaser here that over time, we'd really like to move this dialogue along. We do believe that what we've been able to show in the first 20 countries and what we're doing now in the 31 countries where we're working is a proof of concept that we can get to the next place. We can understand what viruses are out there before they spill over so that we don't have to be afraid and chasing. We can give the public the information they need to make good choices, make good plans, just like we all planned whether or not to get in a taxi or a car to come here today. We accepted that risk. We mitigated our risk by choosing safe passages and the ways that we did things. We need to get to that place for disease as well. So this is just showing us that the way we think to do that is to look at those hosts that are most likely to carry the viruses that will spill over to people, and then those viral families, as I mentioned, that are most likely to be epidemic or pandemic and to spill over into people. Okay, I'm done, Dr. King.
Okay, thank you very much.